Good afternoon, ladies. Welcome to Instagram Live as we are here today talking about clinical trial Living Well. And we are so excited to have this opportunity brought to us with two amazing women, Susan and Bonnie McGregor. Thank you so much for collaborating with BRCA Strong and continuing to make a difference in our community. As really, we need to bring as much resources as we can to help the women in our community. And when I came across this research project, I was absolutely amazing and decided to partner with them and see how we can make a difference. And that's why we're here today, making a difference. And good afternoon, Susan. Thank you for joining us back. Let's see if Bonnie can now join. Oh, we
There
got
she
it.
is. All right.
Awesome. Thank you guys so much. Sorry, everybody who's listening. It's technical problems Friday, but we've made it to this day. So for those of you that don't know me, I'm Tracy, the founder of BRCA Strong. Thank you so much for being a part of this live video today. It is a different project that we are working on, and I was honored to meet both of these amazing women who really are helping our community in different aspects of clinical research. So what I'd like to do is, Susan, if you want to start off with an introduction, and then we'll pass it over to Bonnie, and we can begin our program.
Okay, and Tracy, just let us know in terms of that we're starting late. Are we still stopping at 1:30, or do you want us to take more time just to give us some guidance?
Let's go for like 20 minutes, I think, if we can, unless you guys both have appointments. If we have to cut it at 15, we can.
Yeah, that's fine for me. Okay, great. I just needed the guidance on that.
Perfect.
So, my name's Susan Luckendorf. I'm a professor at the University of Iowa in the Department of Psychology and Department of Obstetrics and Gynecology. And for about 20 years, I've been doing research on the mind-body connection in various cancers. And specifically, most of the work I've done has been on ovarian cancer. And over the years, our research team has looked at and discovered various ways which stress and depression and other kinds of negative emotions can impair the immune response in people with cancer, and can also directly affect tumor growth and can make tumors actually more aggressive. And so after we had worked on this for a number of years and had found many pathways between stress and hormonal stress signaling and tumor growth, Dr. McGregor, Bonnie, and I teamed up together to develop a program. We felt we knew enough about stress at this point, and it was time to figure out a way to stop just researching about stress and help people find a way and develop skills to cope with stress more effectively, to increase quality of life, and potentially affect some of these hormonal pathways that we were seeing in tumor growth. And so about 6 years ago, we started developing a unique program for ovarian cancer patients to do just this. And I'm going to pass it on to Dr. McGregor.
Thank you, Susan. Thanks, everybody, for your patience. I really appreciate it. I'm so glad to be here. And Susan's right. She's actually very humble. She's like a rock star in the field that I do, and looking at how the brain impacts the body, how stress can impact the immune function in cancer survivors. And she just got to the point where it seemed really clear that distress and social isolation and lack of social support was impacting the course for ovarian cancer survivors. We had to intervene. And meanwhile, I've been doing research in how psychological intervention could influence or could help cancer survivors. And we'd already shown in breast cancer survivors that it could not only help patients feel better, like their mood improved, but their immune function improved. And even we saw that in a couple of studies that their survival improved. And so we wanted to take that intervention and build on it and make something that was a little bit more intensive for ovarian cancer survivors, because it's a much more challenging disease to cope with. And it's just been such a delight working with her. We say it's like the best study we could do, because we just blend our expertise together so well. So we've developed a program. It's a 10-week program that has what we think is the very best stress and coping techniques. It incorporates a lot of mindfulness meditation. We tested it out on ovarian cancer survivors over the last 5 or 6 years. We have some preliminary data that showed that it looked like it was going to work. And we got a grant from the National Institutes of Health to do a randomized controlled trial with our friends at the University of Miami and the University of Washington. So it's a big multi-site clinical trial where we're testing the effects of this, what we're calling the mindful living, I think it is, as part of the Living Well study. And in order to do a randomized controlled trial, we have to have something to compare it to. And so we were very careful about developing a comparison program, because we wanted it to be something that was really meaningful and helpful for ovarian cancer survivors, but wasn't necessarily going to change some of the outcomes that we were looking at. So in conjunction with a lot of ovarian cancer advocates, we developed a lecture series on different areas of health and wellness that are important for ovarian cancer survivors. So if you are in we call that healthy lifestyles, and in the healthy lifestyles program, we have lectures on exercise and diet and nutrition and integrative medicine, and one of the all-time favorites, sexuality and body image. Each week they get and there's 10 of them, and each week they have an expert lecture, like a video lecture by somebody who's an expert in the field, and then they have nurse educators who are running these programs. We've already finished one group for that, and the participants really loved it. Our attendance rates are always over 90%. So we're really excited about this program. We think it can make a big difference in the lives of women with ovarian cancer, and we know that there's not a lot out there for ovarian cancer survivors, and it's a tough disease. And so I feel personally really challenged and honored to be working with ovarian cancer survivors right now. So I think, did I miss anything, Susan? I'm trying to do the 20-minute version of it.
Great, that was perfect. I appreciate you guys coming on and sharing, about this research and what we're doing and why the psychological aspect goes along with it. Like a lot of us, I think, and for me who didn't have cancer as a survivor, kind of don't realize the psychological aspect and the impacts that it makes, or we stay in denial. And when you get involved in research and you do mindfulness and become more aware of the programs that are out there, I think it could really make a difference in your treatment, right? On how you heal, and it aligns. So, Bonnie, maybe you want to talk about, or Susan, the inclusion, exclusion of the clinical trial, like what we're looking for. Is I've shared it all over, with our ovarian cancer the NOCC, and just making sure that our ovarian cancer survivors are really aware of what we're doing to make this impact and why it's so important for them to join, because they know a lot of our women that are involved in our community are like, well, I don't want to be part of a clinical trial or a research program, but this is kind of different. As we talked about, it's not pharma, it's a totally different trial. So maybe one of you guys want to go into a little bit more of like why we need stats and why we need this information, so maybe it changes everybody's healing journey.
I can start that, and then Susan could talk more about the study details, like the inclusion and exclusion criteria. So I think that it's really important to do this work, because I tell people that my big message to cancer survivors this year is that this is the best time in history to have a cancer diagnosis, because there's so many treatments out there. Even it's improving for ovarian cancer, and there's still a lot that's not cared for, especially the emotional healing, and there's a lot of supportive care that we can give our patients while they're getting treatment that can really make a difference in outcomes. I'm at the Orion Center for Integrative Medicine, and that's what we do. We've got acupuncture and nutrition and massage, and just really wrapping our arms around patients to support them. And that's what the Healthy Lifestyles program is. It talks about different things that women can do to kind of get their health back. I think when you're a cancer survivor, so often it's hard to know when you get to become a healthy person again. And there are a lot of things that people can do to improve their health after a cancer diagnosis, and also to improve their emotional well-being after a cancer diagnosis. And we think that doing that will make a difference in long-term outcomes. So it's really important. I think that participating in these clinical trials, I want this stuff to be part of standard care. My hope is that 10 years or even 5 years down the road, when somebody goes in for cancer treatment, they get the very best treatment for their body, for the cancer cells, the chemo, the radiation, the surgeries, and they get the very best support for them for their bodies as they recover from cancer treatment, and for them emotionally as they recover from cancer treatment. And right now that piece isn't there. And so women can really help us make that part of standard care by helping us with this study. I always say that the participants who participate in these studies are really helping us push back the frontiers of science. And you get what we think is the very best standard of care for emotional and physical healing after an ovarian cancer diagnosis. So now I will let Susan tell you more about the exclusion criteria, because I'll probably mix it up.
Or even if you wanted to go in just to the inclusion, I mean, you're welcome to share both, but I think it's so important that we let the women like know what they're up against, because I know we have several women who have ovarian cancer who are still in treatment, who are just finishing treatment.
Okay, so thanks very much, Bonnie, for describing that. And yes, our ultimate goal is to get these kind of treatments into standard care, because the emotional and whole person aspect of treatment is just so important to people's well-being. So any ovarian cancer survivor is eligible between the end of treatment and 3 years following the end of treatment. And people with one recurrence are includable. People who have had more than one recurrence are excluded. And there's one other, I'm just blanking on it. There's one other inclusion criteria that I'm just not thinking of right now. But
it's okay. It's on our Instagram page. So if you guys have questions, you can definitely go back and look, and we can make sure, obviously, as we're continuing to help you guys enroll, to make sure we share that information.
But excuse me, it's pretty broadly available to people between the end of chemotherapy and 3 years post chemotherapy. And we asked that when people apply to be part of the program that are on active treatment, we ask people to wait till the end of active treatment, because sometimes it's really hard to be involved in something else while you're actively going through chemotherapy. If somebody is taking PARP inhibitors or Avastin or maintenance treatments, those are fine to be part of the study when somebody is taking those.
You know, what about, and either one of you can answer this, but if they're part of other clinical trials or research programs, are they still allowed to enroll in the Living Well program?
So if they're part of like a drug clinical trial, that's fine for them to enroll. If they're part of something else that might confound our results, like an exercise trial, another like something like steps through ovarian cancer, some other kind of group-based trial, we ask them to wait till that's over until they enroll in our trial. The same thing with chemotherapy. We ask people to wait till that's over before they enroll in the trial. And we do keep a wait list, so that if somebody screens and they're not currently eligible because they're going through either chemotherapy or they're in an exercise trial, we keep a wait list, and so they can get back to us when they're finished, and then we can enroll them.
Perfect. And you guys can enroll either through Braka Strong. You guys, there's the link on our website. I mean, on our Instagram page or Facebook, as well as I can send you the information if you DM me. And hopefully soon we'll be adding it to our website. You can just click that button and click away. Sign up to enroll, because that's what we're here to do, ladies, is, you know, the psychological aspect of ovarian cancer, any cancer diagnosis, right? It's really not touched on. And it's really sad and frustrating for us in our community, whether you're a survivor or survivor. That's such a missing piece of it. I feel like as you heal, you need a clearer mind, right? Bonnie shared something with me recently, and I've listened to the program that you sent me, and I'm like, this is more what we need. This meditation is what we need. This is going to help women in our community clear their mind, like actually sit back and do it. You know, where when you're just told, oh, go online and, you know, watch this yoga or watch this meditation, you don't really want to, right? But when you hear something that is really helping the psychological aspect of our lives and improving our quality of life and getting back to our new normal, I think it's imperative that every center eventually incorporates this. Like you said, like instead of just going on, one of my favorite quotes is, it's not about the breast, it's about the woman. Same thing
Right,
with
right.
ovarian cancer, right? It's not about your ovaries, it's about the woman. And through treatment and going through menopause and fighting all this stuff, and then not having these resources to where now our community is bringing them forward. So now we need women to continue to step forward and to make a difference in our programs that you guys are taking, your time and dedication to develop.
So thank you for saying that, because I think that's really, really important, Tracy. And there's a few other things that I think that I can say. The program is totally online. And so we're hooking up people in Miami, in Seattle, in Iowa, in Alaska, and people across the country are able to be in this. And one of the things about that is that there's people in, sometimes there aren't enough people in any one area to be in a group of ovarian cancer patients. And so this really lets people reach out to other people. We're particularly trying to reach people in rural areas. And we have some technical support. So if you want to be part of the program and you're not really sure how to use an iPad, or you don't have a webcam on your camera, we can provide you with some technical support. We have some webcams that we can lend out to people. We have, if somebody really needs an iPad, we can lend iPads to people temporarily. And so we have a support system to reach out and help people join. The groups tend to be about 6 to 8 people. They're in the same group with the same people for 10 weeks, and the groups are about an hour and a half to 2 hours long. They're led either by a psychologist or by a health educator. And the Mindful Living group lets people practice at home. And so if you're practicing a relaxation technique and you have some questions on it, or want to know what's the best way to implement it for your own benefit, you can come back and talk to the leaders of the group and the other people in the group to see what's worked for them and what's made them successful, or what other problems people are having with. We also have a component on gratitude, because we feel that whatever anybody is experiencing, finding a way to find even a small morsel of gratitude in one's own experience is a way to bring enrichment into the present. And so that's a piece also that we include. So I'm going to turn this back over to Bonnie to see if I've neglected anything that you wanted to say.
This is why we work together so well. Those are really important details, Susan. The fact that we can give people devices so that they can join this, and that it is 10 weeks long, an hour and a half to 2 hours. And also, I guess I would just add that people, it's hard for us to describe this, like what it really is for people, but the responses that we hear from the participants, I think, say it all. One participant said, I really didn't think I needed this. I just joined the study to help you, but I really did need this. I've had people say, this has been a game changer for me, or hands down, the best thing that I've done for myself since my diagnosis. And so I would just leave you with that. It's just that we're trying to make it very accessible. You can help push back the frontiers of science. You're going to learn a lot, regardless of the program that you get randomized to. And I really would appreciate you guys' support.
Joining programs like this, ladies, is a future game changer for us. So as we're sitting here today talking about it, please make sure you review all the information, the inclusion, the exclusion. And if you have any questions, you can always feel free to reach out to myself. But really knowing that being more mindful, learning, different ways of gratitude and expressing it and showing it, the support that Living Well is giving these women, supporting them with cameras or iPads, or, let's make that change. For that 10-week program, let's take that and help yourself to help other women. Because when we participate in research trials or clinical trials, we're helping us we're helping the other women or men that are diagnosed, and we're helping the next generation. So this whole program to me just felt like it's much needed in our community. It must be shared. You know, ovarian cancer, unfortunately, is always caught in later phases of life. So how much data do we really capture in our community so we can learn how to capture it now to help those other women and heal them? Maybe it's stress, or maybe it's taking over your body, like you said, but just taking this program and really applying for it and wanting to be that difference. So I don't know if
Tracy.
You're welcome.
So I can also, people can see this on the Instagram. Our website is livingwellstudy.org. If anybody wants to look directly at the website and find out more information, that website also has a link to a survey where you can see if you're eligible or not. Also has a phone number. You can call us and talk to us if you want to find more information and see if you're eligible. And so we're really looking forward to connecting to any of you who are interested in the study.
For all of my ovarian cancer survivors that are listening, I hope you guys go on the website and see if you qualify for the trial, because filling this trial will only help you and help all the other women that are diagnosed. And I know some of us have a little bit of reluctancy to want to proceed in a trial or research program. If you have any questions, I'm the first one to tell you, be that candidate, be that difference, because without us, there's never going to be change in our medical community. And again, this is imperative in healing and moving through the process. So I'm honored that we were able to do this live today and get all three of us on this call. Yay. And you know, any questions that anybody has, you guys can send me a DM, send me a message. I'd be happy to tag either one of these ladies. And then I just want to thank you so much for coming on and giving BRCA Strong the opportunity to grow and to help our medical community grow.
Thanks, Tracy. Thanks for helping me grow in my Instagram expertise. Now I can live stream with the best of them, just like my daughter, almost.
Wait, Susan's first IG Live was today too, right, Susan? We did a practice yesterday. We didn't know you.
I practiced with you earlier in the week, but this Instagram Live is really a game changer for me in terms of my technology.
But just think, this is where the game changer needs to be, because this is where women search the most, is social media and Google. So remember, do hashtag living well and get their program. So thank you, ladies. I will upload this to IGTV. It'll be there, and I'll send you guys the links as well. And I look forward to having you guys back on in the future.
Cool.
Okay.
Thanks, Tracy. Thanks, everybody.
Thanks a lot.
Bye-bye.
Bye.